we're here to talk about ethics in medicine, surgery, and a little something called anesthesia. I am not saying Anastasia. If people know, like, Anastasia Steele, do you know her? Do you know who that is?
I do.
She's the little submissive brunette girl from 50 Shades of Grey. We're not talking about her in this. We're just talking about something in medicine. So, you're in the business of drugging people. Let's just call it what it is.
Well, that's putting it in different wording than I would, but I think it's providing drugs that bring comfort to people. And
well, all drugs bring comfort to people, if we're being honest. So how did you first get into the drug world?
Okay, I'm not necessarily into the drug world.
Use them day to day, though, in your life. How often do you use drugs?
Personally or for patients?
In any context.
I provide anesthesia for patients on a daily basis.
Yeah, multiple times a day. So
yes.
Would you say you're addicted to drugs, or do you just lie to yourself?
Neither.
When did you do your first drug, and which one was it? And also, would you recommend it?
The first time I provided anesthesia for somebody was, I don't know, 10 years ago.
Okay, I respect that. I'm gonna say a word and you tell me what word it makes you think of.
Okay.
Heroin.
IV drug use.
Well, I think of a female hero. Addicted.
Obsessed.
Okay. Well, I was actually saying a dick did. As in a dick did go inside my pee-pee cheeks. Tell me this, Laura. What is so wrong with someone that you think it's time to put her down?
Put her down as in?
Under anesthesia, down and out. For the
like, dead. Killing them.
Exactly.
We don't do that. We never do that. Ever.
Isn't that what putting someone down means?
No.
What does it mean to you?
We don't really use that verbiage or that term in anesthesia, putting somebody down. But
putting them down under.
We put them under anesthesia. We put them under anesthesia, which means we put them asleep, and they are asleep and sedated for the
rest of their lives.
No.
Because you're a woman, I feel like I should ask you, how do you manage being a mother and having a career?
It's interesting you asked that, because you just assumed because I was a female that I had children.
Yeah, exactly.
Well,
you look like you're of age where you've childbeared. So
that's a little inappropriate.
Okay. Why are all doctors men and all nurses women?
That's completely offensive and inaccurate and unfounded.
All right. Okay, tell me about a time when you were treated terribly by a patient, but keep it really short because we don't have very much time. So just use the words that are really important and don't use the other words.
Okay. There's a couple instances that come to mind, but in general...
Too many words. Just go straight to the story.
Demanding.
Okay.
Ungrateful.
Okay.
Disrespectful.
I can't tell if you're talking to me right now or if you're trying to describe what a patient was like.
What a patient was like.
Okay, because those just happen to be the words that people describe me the most with.
Oh,
so that's really...
I'm sorry to hear that.
Well, don't make me feel like shit about it. Okay. I have a scenario for you.
Okay.
You walk past someone on the street.
Okay.
They're gasping for air.
Okay.
You say, "What's wrong?" They're going like this. They're choking. They can't respond to you. Okay? With sign language, they beg for mercy. They say, "Laura, put me out of my misery. Take my life." Mm-hmm. Do you euthanize them or not?
No.
I'm not saying that you have to try to euthanize them and turn them younger. Okay. Euthanize means kill with medicine.
I'm familiar.
So do you do it or you don't?
I do not.
Are you sure you understand the question?
I understand the question. Number one, I don't have the capacity in that moment to do that. And number two, I'm held under certain legal laws to do no harm.
What do people talk about in the OR? Because if it's all about this areola, that areola, then I don't want to hear about it.
You have a variety of conversations and a variety of different people mixing a completely mixed bag.
Do you know that movie where they sew the lips of the one person onto the other person's ass pussy?
I am not familiar with that. No.
Do you know the ass pussy chocolate pocket? Butthole?
The butthole I am familiar with.
Little circle.
The anus?
Yeah. In this movie, they string up a bunch of people. They sew together, mouth to ass pussy, mouth to ass pussy, mouth to ass pussy. It just goes on and on. 30 people. They feed these people, and it goes all the way through. One link dies. They're one big organism. It doesn't matter the details. It doesn't matter. The point is, would you say that that's a surgery of sorts? It is.
So maybe.
Are all surgeries just another human experiment like that?
Absolutely not. Is this true?
Yes, this is called the human centipede. It didn't happen in real life, but it's happened in the movie.
That isn't.
There was 3 movies too. It's like a first, second, and third is very popular.
I am not familiar with that.
Okay. So, what are your thoughts on private parts? From my perspective, the medical world loves nudity. You know, you go see a doctor, they hand you this sheet to put on. Okay. Oh, by the way, it doesn't even close in the back. What? Easy access.
True.
Like, what's that all about?
We need to provide the best care we can for patients. We need to be able to address whatever issue is going on. Sometimes that is related to the private parts.
That sounds incredibly embarrassing, but I guess
it can be. It can be embarrassing for sure.
For you?
No, for the patient.
Because they have weird-looking private parts, and it's...
I don't even... When we deal with these kind of issues and see people in their vulnerability, I don't think any of us are thinking about that.
Right. How long could people go to sleep for? Like, say, if I was having a bad week or something, could I go for the whole week?
No.
Really?
Well, I take that back. Say somebody in the ICU. They could be that way for an extended period of time.
So if I was interested in hibernation...
I don't know of any doctors or medical providers that would do that electively, but maybe on the black market?
Definitely on the black market, for sure. I've seen it. When's a time that you had a patient on the table and you thought it's just time to let them go?
I don't think I've ever had that situation.
Really?
Yeah.
Okay. People are always talking about patient confidentiality.
Okay.
Why is this so important?
Would you want any of your patient information shared with anybody that you know or...
Definitely not, but I don't see what that has to do with how confident a patient is. Like, what are you going to do with newborn babies? You know, they've barely been alive 2 seconds and already their life is shit. You know, they could barely breathe, and you expect them to, you know, walk around with confidence? Why does it matter?
I think they mean more privacy and confidence than confidence in, like, a surety in what they're doing.
Okay. Say someone dies on the table during a surgery and you bring them back. What would you call that?
ROSC. ROSC.
What does that mean?
Return of spontaneous circulation.
I would call it resurrection.
Okay.
So is that really what happened to Jesus Christ?
I'm not sure. I can't speak to that.
Yeah, but probably.
I don't know what kind of anesthesia was back then.
Yeah, it was a rough kind of anesthesia. What is intubation?
Intubation, technically, is using a what's called an endotracheal tube, and it's a plastic device that we use to insert in between the vocal cords. We use that as a way of breathing for the patient, supporting their breathing, and providing our anesthetic gases to the patient.
So does it go in their throat?
Yes, it goes into their mouth.
Is that where the term deep throat comes from?
I don't think so.
What is deep throating? You know, because all I hear is
Caroline, deep throat me.
Well,
what are they asking for?
From what I understand, deep throating means inserting something deep into your throat.
Okay, so people are trying to intubate me.
Well,
another movie for you. Have you ever seen Texas Chainsaw Massacre?
I think I saw the first one.
It's the one where the guy cuts off someone's face and then puts it on his own face. Is that technically plastic surgery?
Technically, yes.
Yes. Awesome.
Very crude version of it, but yes.
Yeah, that's amazing.
This is an oxygen mask.
I don't feel like I can breathe better at all on this right now.
Well, currently it's not plugged up to any oxygen.
I really don't know if I can get this out. Ass pussy.
Anesthesia is providing comfort and sedation enough for a patient to tolerate a necessary procedure.
So what happened to good old, you know?
It didn't provide the most safe situations for patients.
How do you get someone to this state then?
Through administration of a variety of drugs.
Also, just going forward, I don't like that I'm playing this guessing game with you. I'd rather you just tell me exactly what it is, because I don't really want to look stupid. Okay. And you're just not making me feel like,
yeah, I can clarify.
Okay.